session today, the webinar, is really of paramount importance because, as you know, in 2020, we started the APPNA Merit Nursing Chapter, and a lot of nursing leadership gathered around it, both here in United States as well as England and particularly Pakistan. And those leadership are present here, and we'll hear from them. But also it gives me a great pleasure to first of all say Happy New Year to all of you. This is a new beginning. We hope that 2021 will be a healthier, more prosperous and happy than 2020. And the bar is very low for 2021 to do good. But also in the new year, because as you have seen in 2020, the merit has almost reached a climax in a way that we have done things that we have not done before. We started a lot of new programs. And because of those programs, the merit work and projects have expanded exponentially. And obviously that needed that a young, energetic, and more capable leadership take over. And so that is why I suggested, and I'm glad that the president, APPNA Rizwan Khalid, for this year 2021 accepted that and made Dr. Danish Bhatti the new chair for merit. And I'll be assisting him. And so the team is the same in a way, but it will be a more energetic, more capable leadership. And I'm sure that that will be able to take merit to the next step in the 2021 and beyond. So with that, we start our program. I will invite our new president of APPNA for 2021, Dr. Rizwan Khalid, to welcome all the guests and also tell us about his vision for education, merit, and nursing initiative. Dr. Rizwan Khalid.
Assalamu alaikum, everybody, and good evening to all guests in Pakistan, and good morning to all guests in North America. तो सबसे तो पहले सारों को नया साल मुबारक, और हम ये उम्मीद करते हैं कि ये जो साल है, it's much better in every regard compared to 2020. 2020 was a year of challenges. However, APPNA leadership and merit leadership did an amazing job. And with these challenges, it opened up opportunities that we did not know that we could, utilize at that point in time. So everything being virtual, I think that was a virtual revolution, and APPNA merit was on top of that revolution. Before I start with giving further comments, I would like to recognize and welcome all the worthy, illustrious panelists and guests from Pakistan, from the US. I'm very appreciative of your continued camaraderie with APPNA and APPNA merit in taking this initiative forward. I'm very happy that we are having this inauguration today. The legwork was done, a lot of it was done last year, and this is the process of evolution that we are bringing it to fruition, a process that was started last year. I also want to thank all my co-hosts, my moderators, Dr. Nahid Usmani, Dr. Harun Durrani, the president-elect of 2021, Dr. Nahid Usmani, president 2020, immediate past president, who has been leading the efforts, and the merit was actually her, very close to her heart, and she has led it from the front. And I thank Nahid for all her efforts in this regard. I cannot thank Danish and Dr. Shahid Rafiq enough for what they have done. They have really put in their heart and soul in APPNA Merit, and I congratulate Dr. Shahid Rafiq on completing an excellent year in 2020 as the chair, and will continue to work with APPNA Merit, continue to advise APPNA Merit, continue to help the leadership as well as the committee. And Dr. Danish Bhatti, is going to take over as the chair. The committee will continue to expand as we go through this process of evolution. We have learned from a lot of our lessons that we learned from last year, and certainly we are going to improve on that. Family medicine, and on the request of the highest echelon in Pakistan, we started the family medicine and nursing initiatives last year, and those will certainly continue and will continue with a newfound vigor this year. My commitment to education in Pakistan and the US is one of the most foremost core points of my year, and hopefully years to come. So definitely family practice, family medicine, and nursing. You will find new partners in APPNA. You will find a lot of recognition for the work that nursing does, and to enlighten and highlight the importance of nursing education in Pakistan, which we will continue to do, and you will notice a lot of changes. The other things that we are going to focus in Merit this year is certainly research. That is going to be one of the cornerstones of Merit education in Pakistan this year. Cardiology, since that's very close to my heart, that's my subspecialty, we will be focusing a lot on cardiology. And one of my other passions is emergency medicine, which is to improve emergency medicine in Pakistan by education, by workshops. So these will be the three focus of APPNA Merit. Continued focus, new focus with continued interest in family medicine and nursing. We will also like to coordinate better all the education activities in APPNA, whether that is the Merit, the Academy, APPNA RISA committee, host committees. So we will try to coordinate better under one umbrella and make sure that is something that we achieve. There will be a lot of seminars that we will continue to do. And again, I would look forward to your counsel, your advice, and your partnership in this. Again, with that, I give it back to Dr. Shahid Rafiq. Thank you, and a very warm welcome again.
Thank you. Rizwan, we are heartened by your commitment to education and merit, and I'm sure knowing you and you yourself being an academician and having a lot of educational achievement in your career, this will be a great year, like 2020 was the one. So a little bit of change in the program. I would like to invite our immediate past president, Nahid Usmani, because she is on call and she has to go see very sick patients in ICU. And so I would like to invite her before other in the program to say her perspective of 2020, merit achievements, because she, as Dr. Rizwan said, that it's very close to her heart because she was the founder chair of this committee. And of course, with her presidency, we achieved all that was possible. So Dr. Nahid Usmani, please say your perspective and word of advice for merit in 2021.
I feel humbled. Thank you so much for allowing me to go ahead of my scheduled time. My presidency ended 2 days ago, and I've been on service this whole week, and my clinical service is falling apart with multiple patients in the ICU. A young man presented with 400,000 white count and ended up intubated, ventilated, and has bacteroides fragilis sepsis with gas-forming abscesses in his belly. So that's what I have been preoccupied or obsessed with for the past week. But I am so very glad that Dr. Rizwan Khalid appointed Danish Bhatti as chair. And of course, Shahid is an integral part and will be a very good advisor. And are you going on as co-chair or as advisor?
Co-chair.
Yeah. So I think the leadership is stable, but we are getting younger people ahead. In 2020, with COVID and with our plan for family medicine, we in APPNA realized that it's not just APPNA alone. The interventions have to be done with global collaboration amongst the Pakistani expats. And that the vision has to include as well as the participation of the physicians in Pakistan and nurses in Pakistan. So I think the biggest achievement, besides the APPNA Academy and the initiation of the online learning module, was collaboration. We started collaborating with international partners, which included the Northern European Pakistani Physician Association. And we are so happy to see Amir Bernie here from there. We started seeing the Australian professional organization physicians join in our initiatives, and the Pakistani family medicine and nursing leadership. And Dr. Rafat Jan, I met you for the first time, Assalamu alaikum, in Rawalpindi, when we held a very important session on nursing education and what to get a needs assessment, what needed to be done in Pakistan to improve, because we all know that Pakistan has only 10% of the nurses that it needs to get the right healthcare delivered. And certainly COVID put in a challenge where we needed to up the competencies of nurses in intensive care. I am so proud that we have a nursing chapter, and it is collaboration between US, UK, Pakistan. And I see many of those nurses here, and they have to take the lead, and we can provide the direction and the vision. With Dr. Rizwan Khalid's encouragement, I think all these projects are going to grow. They are, we have very good members of different subcommittees of APPNA that can lead and take all these initiatives forward. We have a very good group in emergency medicine, in critical care, in infectious disease, neurology, cardiology, you name it. We have subgroups present, and each one of them has amazing leadership that can develop educational interventions and can develop, initiatives that will improve healthcare in Pakistan. Impact. So to evaluate the impact, we have to have clinical measures that we are following in Pakistan. And there comes the emphasis that Dr. Khalid has put on research. And it would be wonderful if we tied in, baseline evaluations and then results after each intervention, and be able to write about this initiative that involves international partners and improves healthcare. I think, institutions like Aga Khan are already collaborating internationally I have read so many papers where they have evaluated whether dexamethasone improves neonatal outcome, whether antibiotics, and these are global collaborative studies and that are being done internationally. Can APPNA Merit also launch similar interventions and be able to evaluate the impact of it, comparing different groups? And this can only happen if we have collaboration across institutions, people, individuals in Pakistan with the leadership here in APPNA Merit. But I'm very excited. I'm very proud of all the work that Dr. Shahid Rafiq, Dr. Danish Bhatti, and all their committees did. They went above and beyond. I don't think during the initial 3 months of COVID, they slept at all. They delivered daily COVID nightly webinars to Pakistan, where they brought experts from here with physicians in Pakistan for COVID education. And yet they also launched all these new initiatives. So thank you very much, Danish, and congratulations on being the chair. And Dr. Shahid Rafiq, for all your efforts. I'm truly grateful for all the work that you did. Thank you.
Thank you, Dr. Naeed. We really appreciate your support all through the year, and we look forward to your support in this year as well as in the future. So with that, I think now we are back on the track of our program. I will invite Dr. Danish Bhatti, the new chair of Merit, to, and also he is the main person for coordinating all these courses. So as you can see that a lot of work goes on to develop the infrastructure in developing these courses, as well as conducting these, executing these courses, and learning management systems, LMS, that we have, and we are going to improve those as we are inducting more courses, as we are initiating more courses. Of course, we are going to go to a better LMS, and Danish can say more things about that. And he also has been a great supporter and with me for this initiating nursing chapter in Merit. And so please, Danish, for 2 minutes, 3 minutes, you can give your remarks.
Thank you, Shahid, and thank you, everyone. I think from Merit, the mandate of Merit is to help improve the medical education in Pakistan, bring in the technology transfer, improve research and in informational component. So keeping that mandate in mind, for the nursing side, I see my personal vision that I'll be presenting to the President, Dr. Isman Khalid, and EC will be that I think there are 3 priority goals for nursing this year, and probably in sequence. The first goal should be that we should strengthen and further develop this chapter or section of nursing that we developed in APPNA Merit to bring it more to a national platform of APPNA itself. And I believe there is some interest in discussion in this regard to formalize it, to develop it, to strengthen it, bring a lot more membership to the nursing section so it can grow. The second goal that I see, which probably will stem from the first, will be developing a leadership within the nursing chapter in APPNA so that we can hand over the leadership to the nursing community itself and decrease the role of physicians more as a collaborator and supporter to these nursing leaders within the chapter or section of APPNA Merit in education and in outside education. Of course, my vision is always education. And then the third priority goal that I see that probably would stem from the first 2 is to develop multiple courses in nursing areas. So we're starting with this first one, critical care nursing, that is following the critical care nursing webinar that we did earlier that became a priority because of COVID. But I think there is a strong need for many other aspects of nursing that we can strengthen. I think the educational goal that we can provide here from APPNA, as I see it, is more of skill-based learning. So, it maybe at some point we will be part of diplomas and certificates and degrees and things like that. And we can, of course, be visiting faculty, but we can provide a lot of practical knowledge to practicing nurses that are already in practice and they need some updates annually, or they want to see how someone else is doing in a collaborative fashion. So we have experienced a lot of this in physician aspects. We have developed courses like these. We have partnered with them, collaborated with them through local partners and international partners. And I think that can also be replicated. There, I think live sessions are good, but more and more there will be probably need for hosting courses that are self-paced, that someone can go to log in and do them on their own time, that we'll be working on. Just like we have 7 or 8 ongoing courses in physician side, I think we should have a similar number of courses on the nursing side. So that's what I would be presenting to the president and to EC, and clarify it, sharpen it, make these goals more measurable, objective, and then bring on the leadership in nursing to help us deliver it. Thank you.
Thank you, Danish. So now I would like our course directors, Dilshad and Dr. Mohsin, to present. I think Mohsin has some presentation about the course. This program is inaugurating the course, and we would like to hear what I think over 6 months, or at least 4 or 5 months of hard work that these leadership have put in. I am very interested to hear. I hear that it's a very high level, high intensity program, which is, I think, fine. And we just have to give heads up to attendees that they have to match the energy of Dr. Mohsin and Dilshad, as they have a great enthusiasm for teaching. So Dr. Mohsin, please go ahead.
Thank you, Dr. Shahid, and thank you for all the people who have talked before me and explained what's going on. I'll just start sharing some slides to make things a bit simpler. So it's just a quick introduction of the course that we are about to run for nursing and fundamentals of critical care nursing. As you know, this all started with COVID, so I'm not going to spend too much time on that. But the problems which were identified were that there was a shortage of skilled nursing staff, and that there was no formal structured training program which was focused on critical care in Pakistan. When we got together with Yarane Watan in those days, the focus very much was that how can we help develop these competencies and these skills. And our approach very much is this, what we would say, that give a man a fish, you feed him for a day, you teach a man how to fish, and you feed him for a lifetime. And that's the thinking that we took forward. And what we did was we said we'll do both. So we gave that fish in the form of a webinar, which was very focused on nurses who were new to the critical care environment. And the webinar was focused on the basic competencies they might need to have. And then for the long-term goal, we devised this course, which we are at the inauguration of now, which is Fundamentals of Critical Care in Nursing. If a similar need were to arise again, the focus very much is that we should develop the human resources in the country, that they should be able to go ahead and address any future rising needs, rather than, again, people from abroad coming up and trying to support structures. And I'll go into the depth of that. So the long-term needs is what we are really talking about when we talk about this course. We have our honored panelists, we have the honored guests and hosts. The host you have heard from. I'm hoping that we'll hear a bit more from the panelists, but I'll tell you a bit more about the course. So our aim was not only to develop a knowledge base, it was to build on that and give them communication skills, focus on critical thinking, incorporate research and innovation into practice, and try to teach them how to incorporate data-driven decision-making into the care they provide, improve on the teaching skills, and build on the leadership skills they already have. So this was the basic concept on which we built the whole course. that it should not just be the knowledge base that we are delivering. And of course, the idea very much is that the review of the current international practices was done. And then we tried to have a review of the critical care nursing practices in Pakistan. So you have no idea how many nurses I've had to talk to just to get a rough idea of exactly how does nursing happen in Pakistan. Um, and then we looked at international system and structures, and we looked or tried to look at the system and structures which exist in Pakistan. And the idea very much is we are not there to go and say, this is what you do. It's very much try to say, this is what has worked. How can you incorporate that into your own environments? And then make sure that whatever we teach fits with the social norms and role expectations of nurses in the country. So the developing the course itself has a lot of facets that we had to consider when we're thinking how to design it, how to look at different points of it, how to deliver it. And the key person in doing a lot of this work was Dr. Kabani and, of course, Roshan Jan Mohammed. Uh, I would say a lot of the course development is done by Roshan. Uh, my role has been rather simple in all of this, and Dilshad again has taken a lead role and is doing quite a lot on how nurses are to be trained, how they normally think, how they are to be taught and approached. So wonderful work done by all these people. And so we are able to now actually deliver the course to you. So this was the team which designed the course. And then for delivery of the course, it's myself and Dilshad who would be going along and organizing or structuring the delivery of this course, which is itself based on 12 modules. It will have synchronous and asynchronous learning. It will be pre and post module assessments. There'll be assignments. There'll be QIs. Today was the first day of the course, and it will finish on the 8th of March. And this is a quick course summary as to what the implementation plan actually looks like, which is telling you what the different timings of different modules are, how the focus is, what timings it would be delivered, and how we hope to achieve what we have set out to achieve. I think I've finished it all in my time. So if anybody has any questions, I'm more than happy to answer.
Right. So we will get some questions in the end if, once we run through our program. Dilshad, if you would like to say a few things yourself, please go ahead for 2 minutes.
I think Dr. Mawson has described everything. I have few questions to understand based on what was shared initially. So I'll keep my questions for the end. Thank you.
Okay, great. All right, so we are moving on to now the second part of the program, which is to get the comments and opinion from our panelists. And our panelists today are the Vice President of Pakistan Nursing Council, Dr. Hassan Kasi, and after that, it will be Dr. Rafat Jan from Aga Khan University and past President of Pakistan Nursing Council, and followed by Shabana Ali, who also was key in COVID intensive care program, and herself very eminent neurocritical care, neurotrauma critical care nurse, and a great leader. So in that order, I will ask our panelists to give their comments for 3 minutes each, or 2 to 3 minutes, about this program, as well as anything else they would like to see us collaborating with the Pakistan Nursing Council, Pakistan Nursing Foundation, and other leadership, what other courses they see as the need of the time, and what else can be done by this nursing chapter and nursing leadership. So so Hassan Kasi, please go ahead and give your comments. Dr. Kasi, Hassan Kasi, are you unmuted? Yeah. Please go ahead.
There is no microphone option on his symbol.
Okay, so I will ask Waleed to work on that while we go to our next panelist, Dr. Rafat Jan, who has been the great leader, I think, main pillar in bringing us all together, introducing us to all the nurses in United States as well as in Pakistan, all the nursing leadership. So I would say that she has been the main architect of nursing chapter and all these initiatives. And I really admire her energy and passion in elevating the nurses' training, education, and nursing role and their status in Pakistan. That is very important that we all are striving for. We all who believe in the place of nurses as our partners, physician partners, and not any subservient role, um, and seeing the nursing as integral part of the healthcare delivery team. No patient care can be achieved without a competent, involved, and engaged nurse in that care. So Dr. Rafat Jan, please go ahead.
Thank you so much. It is really nice that what we were discussing in last year in Rawalpindi, we started with webinar of the critical care in COVID, and now we are starting a course. It is so refreshing when we were just discussing yesterday about this collaboration, and now we are actually doing meaningful collaboration. I'm extremely grateful to all my colleague nurses from Pakistan, who is right now, many of them are outside Pakistan, that they are really giving their time. I know you are very busy in the COVID time period with your job, but you're all giving your time. I'm also grateful to President of Pakistan Nurses Federation, Ms. Nigat Durrani, and Vice President Pakistan Nursing Council. Whenever I ask them to join, they have joined, and no nurse has declined me. With all these things, because Dr. Shahid has said enough, I don't have to say much. I would like to welcome Ms. Dr. Naima Al-Gasser from Egypt. We all know Madam Durrani and myself know her. She was WHO nursing advisor in Geneva, and then she became country head in Sudan, Iraq, and right now she is posted as a country head from WHO in Egypt. A very powerful position for a nurse. And if Mr. Kasi is not here, I would like to request Naima to speak for 2 minutes. She was with us in all the critical care. She was with us in webinar or other things when we are doing debates. So I would like Naima to speak for 2 minutes. Welcome, Dr. Naim.
Thank you, Rafat. I was going to ask Naima to definitely speak. I saw her and I know her enthusiasm and leadership and collaboration with us. So Naima, please go ahead and give your remarks in 2 minutes, next 2 minutes.
Thank you very much. Good evening to all of you. Happy New Year. And I look forward that we have a better year in 2021 and always have a challenge that we turn into opportunities. I want to congratulate you, Dr. Shahid, Dr. Danish, and Dr. Rafat, and all the distinguished speakers who have spoken from all over the world and who have really invested in this. I want to congratulate you to making it a reality. And I'm very pleased to hear more words of the teams and partnership. Thank you, Dr. Shahid, to say that they are not followers, but actually at the place and leading this work. I mean the nurses and nursing leaders, whether it's the council or the association or the education or any universities that are there, and including the practitioners. Nurses lost many lives during COVID-19 that were not accounted for. The voices of others, especially physicians, were much more stronger. I would like to congratulate Pakistani nurses for winning several awards. Today, this very critical course, very important, vital course given in Pakistan is actually going to pave the way for many countries in the region. And I'm talking about East Mediterranean region. In my role as a senior nursing and midwifery scientist, decades ago, over a decade ago, we did do a global strategy for nursing and midwifery, which was the first one. And it talked about the nursing and midwifery services serving the patients and serving the clients. Today, seeing this virtual and turning the technology in partnership, meeting one of the sustainable development goals, which is Sustainable Development Goal 17, and at the same time, trying to serve the most needed these days due to the pandemic, I think it's a success story to tell. And I'm sure Dr. Danish and I already heard earlier, a professor who spoke, documented through the family practice. I'm very happy to hear family practice instead of family medicine that brings the team together to serve. And I like the practice, because family practice, because we are talking not about sickness, but we are talking also about promoting health, disease prevention, care, and at the same time rehabilitation. Congratulations once more. Congratulations for this team. And I'm very pleased and very proud to be, at least, I would not say that I have been the contributor, but I've been very pleased to follow and sometimes able to maybe give one message here and there. Congratulations once more. And thank you very much for giving this opportunity. Thank you.
Thank you for your kind words and direction and encouragement. Now I see that Dr. Hassan Kasi has still no mic, but I will go ahead and invite Shabana to please give her remarks, introduce herself, and give her remarks.
Assalamu alaikum, everybody, and thank you, Dr. Shahid. I'm very pleased to see what started last year, somewhere around April and May, just talking about how we can help our colleagues in Pakistan to help them developing more skills and knowledge and competencies to be able to help the COVID patients in Pakistan, knowing the limited resources and everything. And we came up with the idea of starting a critical care course. And I'm very proud to feel the proud moment is for me that because the first brick was from our end to start developing this course that ended up in such a huge and rigorous discussions. And now I can see it has turned out to be a very good course that is ready to be delivered. We people here in US with advanced healthcare system were shaken up by this COVID last year when we nursing population even didn't know how to take care of those patients, but we had resources, we had people who was guiding us, and they themselves were kind of in a trial and error mode to give us the processes, do this, do that. And I was always thinking at my role being a leader in one of the US's hospitals in ICU that if we are kind of shaken up, if we don't know the correct process, how my colleagues are working in other countries with limited information, no competencies, at least we should train, we should enable them to stand up in their units and take care of those COVID patients. And then here we came up with the webinars, and thank you, Dr. Mohsin, Dr. Noor, and they worked so collaboratively, and we were able to had this 9 weeks of a great week of teaching and learning education with lots of learning for ourselves as well. So yes, this is a continuation of those webinars that we were thinking about, we were talking about, and here we see our dreams coming true. It's really exciting moment for me. And the best moment is to have our leaders institution in Pakistan up on the board with us, PNCs and PNF, that we always dreamed about to be the part of nursing initiatives like this. I think that's really encouraging for our nurses in Pakistan. I can see more and and more nurses coming forward with a lot of their ideas and the leadership skills to make nursing a successful profession in Pakistan. And I can echo with the president of APPNA that this should not be limited to the critical care course. We should go out beyond that and look for the specialty nursing, emergency nursing, neuro nursing, cardiac nursing, with the small courses, so we can keep our nurses engaged in this critical engaged. I mean, I know that in the critical courses there would be like limited number of nurses who will be the part of this course, but what about the other nurses? We all should engage them, because the kind of comments we were getting in our webinars is they want to learn. They're just like a sponge at this time, just want to absorb whatever we want to give them. So I would really look forward to those small courses that we can have those nurses be engaged and being a part of these education modules that we are talking about. Thank you so much.
Thank you, Shabana. So now we coming to the next section of our program, which is our guest of honors. And it gives me great pleasure to invite our longtime supporter, great leader in military medicine, and he is the dean in National University of Medical Sciences, as well as Director General of Medicine in Pak Army. He has been a great supporter for all the merit initiative and a great leader in terms of executing these programs. And I'm glad that most of the attendees from in this course are also from military, and I'm sure this will go a great deal in making the need for ICU, because when we visited military hospital and the leadership of Pakistan Army and ICU leadership, the one thing that they told us was that the great need for nursing training in ICU. And I think it was 2 years ago, and that stuck to my mind. And as soon as we got nursing leadership on board, I said, this is something that we need to do. And I'm glad that we are at that point now. So Professor General Imran Fazal, please go ahead and give your remarks in the next 3 minutes.
Assalamu alaikum. Shahid, as usual, it is a real pleasure to see you all there. And I congratulate Dr. Rizwan Khalid and Professor Nahid, yourself and Dr. Danish for another successful launching. We are part of some modules which you are already running, and critical care nursing remains one of the keystones for our patient management. Besides our physicians from the critical care, the nursing officers, and they play a major role. And this is a beautiful initiative which you have taken. And I'm sure not only people from military services, all over the world, the nursing staff from in the critical care, they would be benefiting from this. And I wish all of you a great success, and let this be a great beginning of 2021. And we hope to have more of these webinars as usual, for which now APPNA Merit is becoming a standard. Thank you very much.
Thank you, Professor Imran. Thank you for your support. Next is President of Pakistan Nursing Foundation, Nigat Mehdi. And we are really honored that, the leader of a great organization from Pakistan is on board with us, and a great supporter of all the programs and initiative. And we would like to hear what more can be done for nursing in Pakistan. What is the need of the hour, and how can we collaborate for more programs? Ms. Nigat, please go ahead.
Assalamu alaikum.
Gigi, go ahead.
Thank you very much for inviting me. And last year we were just dreaming the things. We will do this. It will happen like this. And now is the time when we see the dream is coming true. My question will be, and my request will be the same with APPNA group, nursing leaders, and everybody. Please let them work. Sometimes they know a lot of things and they are able to do it. But the administration, my colleague doctors, don't let them do those practices. This is the major issue. Beside these courses, I would like somebody teach our policymakers. They are a big hurdles. If something happen bad, everything is on the nurse, and something happen good, everything will be granted to the senior person, or whether he was present at that time there or not. I always face, being a registrar in Pakistan Nursing Council for 22 years, I always face these problems. Whatever you teach, whatever you give them a skill to do it, they're not allowed to do it. We have to teach, open the minds of our other professionals as well. These these professionals are able to do a safe practice for the betterment of the patients. Having said this, we have already 17 clinical specialties with us. If we can upgrade those as well. It was done when I was student, 81, 82. And still those courses are being given, maybe in minor amendment. But now we need to put these new diseases, new skills, updated things should be included in the curriculum with the help of Pakistan Nursing Council. Because those courses, the new coming generation should learn as a beginner. They should not wait after 4 years, then they will come to your program and learn. This is now part of a life. These diseases are included in our life. So we should work side by side on two things. One is upgradation of the curriculums, as well as most emphasis from my side will be to open the mind of my professionals, medical professionals. Everybody learn by trial and error. Everybody. When we are in the clinicals, everybody's learning. And once you are passed and graduated and got the license to practice, why not being allowed to do it? Every ward has a different problems because the head of the department think better. He is a right. He's always a right. We should do some short courses for them as well. They are also professionals. And after all, going through the different process, then they become a professionals. Thank you very much. This will be my request until we change in Pakistan. Otherwise, no teaching skill will not that helpful what we are thinking.
Thank you, Nigat. I think I totally agree with you. I think we are on the same page, at least in APPNA merit and nursing chapter. We do acknowledge that all the programs, projects, courses, every initiative should be initiated and executed by the nurses themselves. I am 100%, and I know Danish is also 100% on board with that. The issue is that there are two issues. So obviously in Pakistan, the mindset, the change in mindset, of course, we will try, we will do our best, but there are limits to what we can do. So when we reach those limits, then we think to ourselves and say, what can we do within those limits? Can we just say, because it's useless, because people are not going to change, because the leadership in Pakistani institutions is not going to change, then that's it. there's nothing more to do and we shouldn't do anything. Or we be pragmatic and do whatever we can do, because obviously, as you say, the leadership and taking the charge is important, but at the same time, clinical issues and clinically taking care of the patient is also important. So these courses may not, provide a leadership training, which can be a separate course and separate course for administration, as you said. But at the same time, those patients with the severe sickness and admitted in ICU do not know these politics and should not be the victim of the politics of conflicts and not understanding and not doing the right things. So that cannot prevent them from getting better by more educated, more trained nurses in those specialty care disciplines. And to other part is that, like I said, that we are always for the nurses programs and nursing initiative to be initiated by the nurses, run by the nurses, and completed by the nurses. And physicians will be always available as a backup, as an assistant. We will gladly assist all the nursing leadership, all the nursing educators, all the nursing course developers. We will assist them. Having said that, there were issues, and I don't want to go into details, that led to the delay of this course. And finally, I, as a chair, put my foot down and said, let's start it, whatever it is at this point, whosoever is running, let's start and see how it goes. And so like we say that, perfect is the enemy of the good. So this course may not be perfect, but it is, I think, good. And at least we are starting it and we will learn from it. And at this point, I would also like to say to you, Nigat, and we already discussed with Rafat, that the next course can be a community nursing, family practice nursing course. And I would like you to take charge of that, developing that course from Pakistan side, from the nurses from here in APPNA merit section. And I'm sure Danish will agree with me that this should be the course that should be ready in the next few months, so that at least by July we should start that course, next course. So with that, I will invite our guest of honor, Amir Barni, who is the president of APPNA, and from England, UK, a great supporter of merit, great collaborator. We are so glad, and I would like to mention that Amir was the one who introduced me to Mohsin way back. Whenever last year in the beginning, I asked him that we need more intensivists from UK to get involved in our programs, which we were doing for COVID. And Mohsin has been great. We think Mohsin is like part of merit, but of course he lives in UK and is part of APPNA. So Amir, go ahead and give your remarks.
Thank you, Dr. Shahid Rafiq. Assalamu alaikum, everybody. Good morning, good afternoon, good evening, wherever you are, and very blessed New Year to you and your families. First of all, I would like to thank APPNA Merit and APPNA for giving the opportunity to me on behalf of APPNA to come and say a few words. I saw a few of my fantastic colleagues here already speaking at great length, but I must acknowledge the work done by Danish Bhatti, yourself, Dr. Shahid Rafiq, Professor Nahid Usmani, and the ongoing work by Dr. Rizwan Khalid, and hopefully by Mr. Harun Durrani in future. So it's really good to see such a fantastic group of individuals working so hard. I must also say hello and welcome my colleagues from Pakistan, Madam Nigat Jasturani speak at length, and Professor Afad Jan. So it's a pleasure to see you here, and then Mr. Van Ali and Dr. Mohsen Zaman, who we still own in UK, although I know you just said that he looks and is very familiar with the APPNA Merit program, and you would like to take him on board. He is an absolute fantastic colleague to have, I must admit. So thank you all, everybody, for being here and to initiate this program. I would especially like to congratulate APPNA Merit for their efforts, the continuing efforts they have done ever since the inception of these online critical courses, and especially in relation to the critical care course for nursing. I think it's highly pertinent given the uncertain circumstances and the learning we have managed to achieve from the COVID crisis and the pandemic. And I'm thinking this is going to be of immense benefit, not to nurses just in Pakistan or our colleagues in nursing in Pakistan, but also worldwide, as somebody said earlier. So I think this course will go a long way in establishing a fantastic resource for nursing and doctors across the world. We call it the new normal in the UK now, post-COVID. Hopefully at some point we will be post-COVID. But as we move forward from here, I see a sea of change. And I've been hearing words about collaboration, synergistic working, leadership came up, but also we need to learn from each other's experience and expertise. So I really revere my nursing colleagues, because I think my nursing colleagues have taught me a lot as a sort of travel to my career as a medic. So there is so much to learn from our nurses, and sharing of experiences and expertise goes both ways. It's not just a one-way track. I totally and utterly believe in it. So I'm hoping that this critical care nursing course will be as successful as previous courses by APPNA Merit. I must congratulate the course directors, Dr. Mohsen Zaman and Ms. Shabana Alif, because I think really the onus is on them. And Dr. Mohsen Zaman has already given us an elaborate description of how the course is going to work. So I really congratulate them and I wish them all the best. So finally, I would like to wish APPNA Merit all the best, all the course participants at the Federation of Pakistan Nursing and the Pakistan Nursing Council and their representatives. I think it's a really big, important step forward. So all the best to everybody, and thank you so much.
Thank you, Amir. It's always great to have you, and thank you for your support. One of our guests of honor, Dr. Tanveer Khalik, could not come because he is in actually ICU, not himself, but with an emergency in his institution, and that's why he could not join. But I would like to mention that Dr. Tanveer Khalik is another big supporter of nursing leadership, nursing programs in Pakistan, and one of the few. And I again agree with Nigat that there should be a lot more administrator and chancellors and principals like Tanveer Khalik who should give respect and due status to the nursing leadership and let them flourish, let them groom, let them develop, and let them lead different nursing initiative in Pakistan. And we are working with him for Shaheed Zulfikar Ali Bhutto University in Islamabad and Pakistan Institute of Medical Sciences in Islamabad, and hopefully, have some programs in that university. With that, we are coming to the end of the program. I would like to say if someone has a question about the infrastructure or leadership level program, we can have a couple of questions from the panelists, but there will be time more later on after the closing of this inauguration session for going into detail of the course. So the attendees as well as panelists who are interested to learn more about the details of the program, the course, they should please stay on after the inauguration conclusion. But others will be excused and at the end of the inauguration. So if there's a couple of questions for the general leadership of APPNA or APPNA Merit, please go ahead at this time.
I have a question, if I may.
Sure, sure.
So I am very new to this circle and trying to learn from today. I cannot agree more with Madam Durrani when she mentioned about collaborative work issues. So when we were trying to understand these candidates during interviews or even before interviews, we try to explore things like patient family centered care, collaborative care, work environment, incident reporting, and there were big gaps which we learned. I like to know more that educating or providing this knowledge, they will feel more knowledgeable, but if collaborative practice model is not there, if whoever they're working with today, if they are not ready to see them more educated, how they are going to practice, who is going to support, who has the ownership of this program today, tomorrow they will be more educated and then they will go into distress that now we know more, still we cannot practice. So my thing is ownership part, partnership with physicians. And one thought which came that can we also have physicians who work with nurses in Europe or North America? Can we make them like mentor of these physicians, like how they work with nurses? Because physicians in Pakistan, they may not even know how to work with nurses because they have seen their seniors and they're following, and they're in their mind, they're right. Like they don't even know what they don't know. So it's not only knowledge which we need to promote, I think model of care, collaborative practice, work environment, patient experiences, like there is much more which we need to bring. When I hear that we need to educate our nurses, that is a very tiny part of a bigger picture. So how can we think a little bit more on see the actual outcome, which is patient experience? It's not knowledge. Actual outcome is patient experience. So how we are going to measure that impact from all these investment, which great investment, which we are talking about today. So, so that was one thing. And second thing, as a course director, I very much like to look forward to see those employer of these nurses. I like to know what they are hoping to achieve out of this, because they are prepared, but those director of ICUs, like, yes, leadership always want their nurses to be more educated, but then who is there to support them? Like, what is the ownership which they have? Do they even know like how they are going to implement their nursing, their learning? So if at some point of time, if we as a course directors can meet with their supervisors to learn what they are hoping to achieve, do they even know what they're going through? What are the opportunities in their unit where they will practice what they are learning? So that would be really, really helpful for us. It will give us meaning of this investment, that it is going to go into right direction. That's it. Thank you.
Thank you, Dilshad. I think you brought a really, really pertinent point. And thank you for bringing it up. We have had looked at it in the beginning. When we started developing this program, we definitely looked at, and we know that it is very important. It's not only nursing. I can tell you that Danish is here when he started his movement disorder course way back in like 4 years ago. And all the courses that we are starting now are modeled around that course, which is still ongoing. He does it every year. And that led to some neurologists in Pakistan who were junior neurologists or even trainee. They were under training, like doing FCPS. And so once they did that 6 months movement disorder course, they knew more than their professors. So if they were trainee, they knew more than their professors. And Danish can tell that that was definitely a challenge for those um, who learned from him how to contradict or confront their faculty that no sir, it's not like this, it's probably like that, and they did not like it. So this is not a specific to nursing. Even in other areas, if Pakistani masses will go more enlightened, for example, they will ask their leadership, what are they doing? And there will be a clash. And so obviously there is a reality to that. But what APPNA can do, or APPNA Merit can do towards that, is one example is that we took a big chunk of attendees from military, exactly because Dr. Professor Imran is the Director General of Medicine, and he's the Dean of Pakistan, NUMS, National University of Medical Sciences. So we have a very good relationship with him, and we know the head of ICU in Pak Army, which is Brigadier Naseem Arshad. So we can definitely involve him, like you said, in a session along with other leadership, and ask them this question. And you, as a director, should have a one-to-one with them and understand what is that they need, and what will happen with all these educated nurses when they will challenge the status quo, when they will challenge the routine care that has been doing, and now they want to do it in a different way, which is more in line with the guidelines. So that is why we did put emphasis while selecting these candidates, and then obviously that the selection of candidates got prolonged, and kind of people got antsy, and so that's why, like I said, I wanted to just wrap it up and start. And so this will not be a perfect course, but we will learn from it. We will learn what will happen when these nurses will go back after 5 months to their practical life. But at least we can have these military leadership. I don't know if Dr. Imran, General Imran, I don't see. Uh, Maybe he had to step out. Otherwise, I would have asked him to directly answer this. But anyone else who has any question about this?
Shahid, may I come in?
Gigi, sure.
Yeah, I just want to acknowledge what Madam Dilshad Pirani just said. She's raised some really pertinent comments there, as did Madam Rafat Jan earlier. And I do believe leadership is key. And developing leadership is one of the most important things we should do right at grassroots levels in all professions. But also things like informed decision-making and team decision-making, where all the stakeholders are equally involved, is also quite an important step as you develop any course wherever we are. Non-technical skills are very important. We put a lot of stress on non-technical skills in the UK, for example, communication skills, breaking bad news, communicating with family. We live in very difficult times in ICUs, critical care, A&E, for example. So I think these are really important. So I think Madam Dilshad Pirani has raised some really important points there. And again, if we can input from my end, we can input anywhere, non-technical skills, communication skills. I'm more than happy to offer that help and support. And I must also acknowledge Dilshad Pirani as the course director. I might have said Madam Ali earlier. So Dilshad Pirani and Dr. Mohsen Zaman, I really wish you all the best as course directors. Thank you.
Can I suggest, yes, Dilshad, even in the 2 or 3 smaller group, we discuss these problems a lot among ourselves with the APPNA leadership. And yes, I know sometimes, there was a book, go 1 step forward and 2 step backward. Sometimes we felt. However, while we are starting, and I talked to nurses who even attended webinar about a webinar, at least it is giving nurses themselves a fresh air. and that fresh air brings new energies. What I would suggest, and I'm going to discuss with Dr. Shahid and Danish, and maybe Dr. Amir, and then you also join. We can do some action research. What do I mean? That we have one focus group with them, and as they are taking this course, how they're moving, how we help them to move, and this is just the starting of first course. But then, as coming years, we have to give them leadership course. I hear from very experienced our Pakistani national that at the policy making level, even in COVID, nurses are working, they are dying, and I'm sitting in Prime Minister, but I know the policy maker nurses are missing in a way. So we have to go all the way. If you see Pakistani Parliament and Senate, I was surprised when Senate called when I was president of Pakistan. There was 11 people committee, and on that committee, 8 were doctors. So I think we have to slowly develop them. This is our only first step. But let's go through action research. Let's do collaborative work. And I agree with one of your suggestions. Maybe we need to give one course in the multidisciplinary where doctors and nurses are together. And I think family practice course will be the best course where they, at least we purposefully build some modules in the multidisciplinary course. And when they do courses and these things today, I found, and when they're doing research together, I found very good impact. So thank you for raising this point, and let me reassure, we are too much aware and we are too much into it. Thank you.
Great, thank you, Dr. Rafat. And I'm sure Danish, this is one thing that is close to his heart also, the leadership courses. So we had talked about leadership courses for physicians, leadership, but also we can, involve the nursing leaders to develop and execute nursing leadership courses. And maybe, again, to not put them in silo, maybe develop one course which will involve physicians as well as nursing leadership in one program. And that would be something to exactly address what Dilshad has pointed out. So I think that's one action item for Danish for the next year. But with that, I think I would like to invite again our President Rizwan Khalid to conclude this session. Our President-elect was not feeling well, and he texted me that he had some sore throat, so may Allah give him shifa, and he will get better soon. So Dr. Rizwan Khalid, please give your concluding remarks and close this inauguration session.
Thank you, Dr. Shahid, Rafiq, Dr. Danish Bhatti, all the guests of honors, the panelists, the course directors. सबसे पहले, if you don't mind, मैं थोड़ा सा उर्दू में भी बात करूँगा. मैं आप सबका बहुत बहुत शुक्रगुजार हूँ कि आपने very frank discussion हुई है. This is very important. I think it's important to have a frank discussion about issues of nursing and issues of healthcare in Pakistan and everywhere else. I think when we start something, you cannot solve every single issue. Some of these are very deeply ingrained issues. लेकिन हम आहिस्ता आहिस्ता कहीं से शुरू होंगे, and we will achieve things in the future. So मेरा ख्याल है कि I think this is a great opportunity to start empowering ourselves and start educating ourselves. The most empowered healthcare professional is that one who is most educated. So education is first and foremost. जहाँ तक attitudes और सारी उसकी बात है, वो आहिस्ता आहिस्ता बदलेगा. Maybe at a medical student level, at nursing student level, we need to get involved. But I think this is a great beginning. critical care nursing. Inshallah ta'ala, we will start even other nursing courses. Jis tarah I have listened to everybody throughout, or nursing cardiology, nursing emergency medicine. I think we may even have an entire committee which will be dedicated just to nursing programs. Other thing is, jis tarah Dr. Danish Bhatti ne shuru mein kaha, I have a lot of other plans for nursing members in the US and North America, and how to bring them in the fold of APPNA. I did not want to speak ahead of time, because jab tak hamare paas proper approvals nahi hai, I did not want to announce anything. But certainly this is part of my plan to bring nursing members into the fold of APPNA, whether it's a chapter, whether it's associate membership, whether it's committees. तो इसमें जो है वो थोड़ा सा हमें टाइम दीजिए. We will go through the process. Membership committee hai, there is a cable committee, there is the executive committee. But I think there are good things that are coming. We made a great start last year, and this is only going to get better. With that, I thank everybody again for participating. To all the course directors, especially, you have done a great job till now, and you have a job to do in the future as well. Thank you, Shahid Bhai.
Thank you, Rizwan. So with that, I'm final point from me. Like Dr. Rizwan said, that there are other courses will be coming, and CCU, like critical जो coronary care unit जिस तरह पाकिस्तान में है cardiology के साथ, I think those nurses who are involved in CCUs and critical care cardiology patients need to learn more about ECG, as we call it here, EKG, or other modalities that are needed in day-to-day care of cardiac patients, as well as my own specialty is as vascular neurology, which is stroke. And that's a whole different area where nurses are becoming stroke nurses or vascular neurology nurses. And in our international stroke conference with the American Heart Association, we have so if the conference is 3 days, we have 1 full day for the nursing. And they come together, all the stroke nurses around the nation from North America, and they spend the whole day in education for the nurses, by the nurses, and that's then nephrology nurses, like dialysis, the nurses who are taking care of dialysis patients need probably more training, hands-on training, and so forth and so on. So I think the horizon is big as much as we can. With that, thank you for all the panelists and guest of honors, and any one of you who would like to stay on, please stay on. I think the course directors are going to go into more detail and maybe introduction of the attendees, and I would like to see the attendees at least today, if that is part of the program, where they are from, which institutions, and if that is possible, I will stay on. So, but anybody who would like to leave, this is the end of inauguration session. Thank you. Assalamu alaikum.